Good morning, students. The next topic of our Explain Why series is bleeding tendencies may occur in obstructive jaundice. The secreted conjugated bile, it flows along the bile canaliculi and bile ductules. It drains into the common bile duct. We can see the right and left hepatic duct join to form the common hepatic duct. It joins with the cystic duct to form the common bile duct, which opens at the second part of the duodenum. In the resting state, the sphincter of Oddi is closed. So when the pressure in the bile duct it exceeds 7 cm of H2O, bile enters into the gallbladder via the cystic duct. Finally, when food enters into the intestine, contraction of gallbladder and relaxation of sphincter of Oddi in response to neuronal stimulation. As a result, bile flows into the second part of the duodenum. Bile flows into the second part of the duodenum. Now, what are the functions of bile in the intestine? The most important function is the digestive function. It helps in the digestion and absorption of fat. Absorption of fat-soluble vitamins is the next most important function. So, these fat-soluble vitamins are A, D, E, K, most important. Other functions are neutralization of gastric acid, and the excretory functions are like excretion of bilirubin, cholesterol, and many endogenous waste products are also facilitated by the bile. Now, obstructive jaundice is a condition which occurs due to the obstruction of the common hepatic duct at the level of common hepatic duct or at the level of common bile duct. So, the movement or flow of the conjugated bilirubin, it is hampered. This leads to defective fat digestion and fat absorption in the intestine. As the fat absorption is diminished, the absorption of fat-soluble vitamins like A, D, E, K will also be reduced, will also be affected. Now, vitamin K deficiency leads to coagulation disorder. Why? Because this vitamin K is required for the conversion of factor 2, factor 7, factor 9 and factor 10 from their inactive form to the active form. Vitamin K actually, what does it do? In its reduced form, we can see vitamin K in its reduced form helps the gamma carboxylation of glutamic acid residues of these inactive clotting factors. And the gamma carboxylated glutamic acids, we can see here it is gamma carboxylation. When the gamma carboxylation is done, these coagulation factors, vitamin K dependent coagulation factors like factor 10, factor 9, factor 2, factor 7, they can now bind with the calcium ion, and this converts these inactive clotting factors to their active form. So this is the coagulation cascade. Here we can see that the vitamin K dependent coagulation factors, they play very important role in this cascade. Now vitamin K, the reduced vitamin K, when it is doing the gamma carboxylation of the inactive coagulation factors, it itself will be converted to its epoxide, vitamin K epoxide or oxidized form. Now vitamin K epoxide will be reconverted to the reduced vitamin K by the enzyme vitamin K epoxide reductase. This reconversion is very much important to keep a continuous conversion of this inactivated coagulation factors to their active form. So by this we can explain that obstructive jaundice, in case of obstructive jaundice, there will be less absorption of vitamin K. So there will be less functioning of the vitamin K dependent coagulation factors, and as a result of that the patient will have bleeding tendencies. Thank you and subscribe.